Okay. So this is an article from the New England Journal in 2003, and it's just a review about body packing. So the first one was described in 1973. It was a man who had swallowed a condom of hashish about a week and a half prior, and he presented to a hospital in Toronto with signs and symptoms of bowel obstruction. So since that point, what we know has all sort of unfolded from there. And they're also called swallowers, internal carriers, couriers, or mules. Most of the time, they are transporting heroin and cocaine, but other drugs such as amphetamines and MDMA and marijuana have all been described as being concealed by body packers as well. It's generally about a kilo of drug, and it's divided to from 50 to 100 packets. And each packet can be considered to have a life-threatening dose. And men, women, and children have all been described as body packers. So stuffers, the distinction is stuffers are people that are just swallowing a pretty small amount of drug quickly, just for fear of arrest or fear of being caught. And it's not wrapped in any special way, and so they have the potential to get quite sick. Packers are professional, and there's many ways of wrapping it. I think the most common, this is how they describe it, is it's initially put into a latex sheath that's a condom or a balloon, and then it's wrapped over and over again with other layers of latex, and it's sealed tightly shut with wax. And then on top of that, they can put carbon paper or plastic food or something to try to hide its radio density so that they can not be detected. They usually swallow them. They can insert them really anywhere else, and they've all been described to be in the rectum and the vagina as well. Their travel time is about 3 days, even up to 3 weeks, so they're all going to take constipating agents, and when they reach their destination, they then take enemas and cathartics. And the police at the airports, anybody that they deem to have reasonable suspicion, and they have a whole host of lists of what they consider to be reasonable cause, they can detain you, and they can observe you, they can x-ray you legally. They present to healthcare either either because they have effects from the drug, or because they have symptoms of bowel obstruction, or just because you're being asked to medically clear. So you start with a history, realizing that people can be dishonest, and the type of drug, the number of packets, any of the symptoms. The physical exam is targeted towards identifying toxidromes. And in the paper, they also said anybody who, I actually had a case when I was a fellow of somebody who just was acting bizarre after getting off of an international flight and turned out to be a body packer. So regarding the workup, the place to start is the x-ray with the realization that it's not enough. The sensitivity is about 85 to 90%, and it's good. And for what you can see is either you can see radio-opaque densities, or you may see something called the rosette sign. And the rosette sign is air when they tie the actual part of the balloon. Sometimes there's air trapped in the tie. So a bunch of them on an x-ray looks like a rosette sign. A double condom sign is this, which is just air trapped in the latex layers. And there's been a couple of reports of people who have had a lot of packets, over 100 packets, and they had negative films. And it's not clear if it was because of technique or just not being read by an experienced person. Either way, it's been reported as negative. So it's a place to start, but not the place to finish. They talk about ultrasound as having potential, but not enough done yet to decide. And the next step is either a contrast CT or a contrast enhanced radiography, like a barium study. The sensitivity is high. It's listed as 96% in this paper. So pretty good, but again, there is a false case, a false report of someone with a negative CT who had a packet. So again, not enough. And then there's some experimental stuff out there that looks at the Hounsfield's units and whether or not you can detect what it actually is, cocaine or heroin or whatever is on the thing. This is sort of out of place. This was just their management slide, and I just go through it. But this is in the paper, just about how to manage body packers in general. So here's how it goes. If symptomatic heroin body packers can just be managed medically, and they can go to an ICU, and they can get a naloxone drip, with the realization that it might be high doses, and you're just watching out for other complications like acute lung injury. Symptomatic cocaine patients go to the operating room regardless, and they're just temporized with supportive measures like benzodiazepines, nitrates, lidocaine, so on and so forth. You treat amphetamines like you do cocaine. And the other reason for going to the operating room is obstruction. And asymptomatic patients all get watched in the ICU with allowing for spontaneous passage, and they cite a 5% failure rate with that. All patients should get decontaminated. The exception is if they're going immediately to the operating room. And activated charcoal and whole bowel irrigation are recommended for all. Avoid oil-based laxatives because they may destroy the latex of the packet and lead to release. And they mention promobility agents, which have been used in some 1 or 2 areas, but not enough frequency to say whether or not it actually works or whether there's harm. But charcoal and whole bowel irrigation are the two that have to be done. Regarding endoscopy, it generally is not recommended because there is this potential of rupture, and I think it really just depends on how well that packet was wrapped. So, and the other thing is that there's usually a ton of packets, so endoscopy doesn't help. The exception might be if I had a case with them in Bellevue where it was one packet, it hadn't gone past the pylorus, and they knew we had the other packets, and Bob or Lewis sawed through it and then showed it to the endoscopist and was, tried to prove his case for it wouldn't rupture. And they allude to that sort of in the article, that's the one case where they would do it. But otherwise, it's not a big benefit. And again, surgery if there's complications for obstruction. And to medically clear people, never do it alone on a package count. It's package count, if you could get that. It's 3 clear stools while being whole bowel irrigated, and then a follow-up study, such as the CT or the contrast-enhanced radiography, not just an X-ray. And if the police aren't with them, to strongly consider getting your legal team or your ethics team involved. And that's it. That's it.